Welcome to the Center for Reproductive Medicine, Getting Ready for Your Surgery. This presentation was designed to help you understand the process of your surgery, your hospitalization, and the recovery needed for your tubal reversal. You have decided to have your tubes reversed. This is referred to as a tubal reanastomosis. The blocked segments of the fallopian tubes are reconnected using very small sutures. Your physicians will do their best to repair both sides so that you may reclaim your fertility. The tubal reversal incision. This incision is very similar to a C-section by cutting through the abdominal wall. This allows the physicians access to the uterus and tubes. What will happen today? Your nurse will review the presentation information, answer your questions, and you'll even have time to sign your consents for the surgery. You will then see the physician today so that he can listen to your heart and lungs. You have this time set aside with your physician to review your questions and any concerns that you may have. What do I need to do when I leave the office today? You will need to go to the registration desk at the Mobile Infirmary Medical Center to do your pre-op screening with a nurse there with the hospital. You need to get your prescriptions filled, but don't take any narcotics prior to the surgery. What should I expect the morning of surgery? You'll need to go back to the registration desk at the Mobile Infirmary Medical Center. There, the pre-op team will review your information with you. Your anesthesiologist will be on hand to speak with you prior to the surgery. What does NPO really mean? Well, what it means is that you should have nothing to eat or drink after midnight before your surgery. This means no gum, no candy, no mints the morning of your surgery. You may brush your teeth, but please don't swallow any liquid. The only exception is if you're on blood pressure medication, you can take that with just a tiny sip of water. This also means no prenatals, no thyroid medications, all other morning AM medicines should wait. This is really to ensure your safety during surgery. The day of surgery, you will arrive at the Mobile Infirmary Medical Center 2 hours prior to your surgery. It's important that you not drink or eat anything after 12 midnight the morning of your surgery. This means no water, no gum, no candy, or any mints. You can brush your teeth, but just don't swallow any of the water. Day of surgery. You will be admitted to the hospital overnight. Your physician will come to the hospital to check on you the same day as your surgery, as well as the following day. You might even be released the following day after surgery if there aren't any complications. You're home. The first thing to realize is that you just had a major surgery. It's time to take it easy. You need to rest and allow your body time to heal. Take your pain medications in moderation. When can I go back to work? The physician may allow you to return back to work in 2 to 4 weeks if there's no complications. Normal recovery for this surgery can be up to 6 to 8 weeks. What are my restrictions after surgery? No pushing, lifting, pulling heavier than 5 to 10 pounds for the first 2 weeks after surgery. Someone also needs to drive you for the first 2 weeks. And please, no intercourse for at least 7 to 10 days. What about pain control? Take your pain medicine as instructed on the label. Alternate your narcotic pain medications with Advil or Aleve. Narcotics and abdominal surgery can often cause constipation. Talk to your pharmacist about a laxative that may work best for you. How to clean your incision site. Clean your incision twice a day with hydrogen peroxide. Keep the site clean, dry, and report any problems. You can shower the day following surgery, but avoid tub bath, swimming, or jacuzzis for at least 2 weeks. Leave the strips of tape on the incision for at least 7 to 10 days. It's okay if the tape looks dirty or starts to peel off, as long as the incision stays closed. What's not normal? It can be normal for the area around the incision to be hard several days after the surgery. This just means that you're trying to heal from the inside out. But please call the office if you have the following symptoms: an incision that's red, warm, and tender to the touch, excessive drainage from the incision site, fever greater than 101.5, or any gaps in the incision that are draining. Post-op follow-up visits. Your nurse will make your post-op appointment for 2 weeks after your surgery. Please submit your FMLA paperwork early, as it can take up to a week for us to be able to complete this. And make sure that you call us with any questions or concerns that you have. To summarize, go downstairs to the registration office at the hospital once you leave our office today. Go out the doors of this office, turn to the right, take the double elevator down to the first floor. Turn right, go through the atrium, past the gift shop, past the chapel, continue down this hallway, and you'll see the registration office to your right. Make sure you have your blood work drawn prior to surgery. Make sure that you've made your 2-week post-op appointment, and pick up your pain medications. Just don't take any prior to surgery. You have now completed the pre-op presentation. We wish you the best experience with your surgery. We hope you have a speedy recovery. Please let your nurse know that you have now completed this presentation. Your physician will be in shortly to answer any questions that you may have about your surgery.